So tell me, when you start losing your hair?
I was about 45 years old, and it was just sort of the typical hair loss you get from age. What was it called? Hereditary.
And who in your family has a hair loss?
Well, my older brother, my full older brother, has a very similar pattern to me, and I recollect uncles that sort of had this sort of hair loss.
Okay. And does hair loss or has hair loss affected you in any sort of personal way, or as far as confidence, everyday life? Does it make a difference to you or not?
Yes, I really sort of, as it's gotten progressively worse, my confidence sort of in general is diminished, and sort of would like to change that if possible.
We're going to change it today, don't worry. Do you have any, what was I going to ask you? Oh, have you had any prior surgeries prior to this? On your hair?
No, none at all.
Okay.
This is the first try at this.
Okay. And how did you find Natural Transplants? Where else did you look?
Well, doctor, I like anything. Now with the internet, you can pretty much research just about anything you want to do, and I spent a couple of weeks maybe visiting different sorts of hair transplant sites. And when I arrived on your site, your sort of professionalism and approach to this procedure sort of sold me, and I was through looking and selected you.
Excellent. And where are you from?
From Panama City, Florida.
Okay. Okay, I'm here with Bill, and we just finished his surgery. Bill, how's the day been for you today? Tell us a little bit about your experience.
Well, it was surprisingly painless or comfortable. I don't know what the right adjective was, but it's surprisingly well.
What have you been doing all day? I mean, you got here around 2 o'clock. It's about 6 o'clock now, between 6 and 7. What have you been doing? Have you been screaming in pain? Have you been comfortable?
Well, I've been very comfortable. I've watched TV and cutting up with your technicians and just having a pretty good time.
Excellent. Well, I'm going to show you what we've done today. If you want to come in here and zoom in, you can see that we've recreated an entirely new hairline for him. Actually, the old hairline he used to have, we just put back on. So what we've done is, in this frontal zone, we've done some 1 and 2 hair grafts, and it's nice and staggered. And you can see where his new hairline is going to be and how it's going to make his profile. Behind this transition, behind these tinier grafts, we have larger grafts, and that has gone all the way back into his crown area. So you can see the amount of surface area that we've covered from a single procedure. Each one of these bigger bumps is actually representing about 6 or 7 hairs. It's not going to look pluggy based on his hair type. It's going to give him density that he needs. So I'm very happy we were actually able to get him a 3rd strip, so we got him extra tissue today, and that's just because I want to knock it out of the park. I want to show people that even people with extensive loss or a little more moderate loss can still get a great result from a hair transplant, even with 1 procedure. As long as you have the right surgeon and the right types of grafts, you're going to have a great result. I'm going to come around here and show you the suture line. Alright, so I'm going to have you zoom in here on the suture line, and you can see that the edges are completely together. All the way around. All the way around. And he has a little bit of post-op oozing. That's normal. That means he has good blood supply. That means he's going to heal great. You want to try to minimize the movement of your head the first 2 or 3 days after surgery. You can see that that is going to be a suture line. It's completely together. No gaps, completely perfect. And again, his hair, even as thin as it is and being wet, can cover this up very easily. Alright. Showing up. So thanks for being such a good sport today, Bill, and is there anything else you need to need, of course, you can call me. All our patients have my cell phone number, and we're happy to talk to them. We can't wait to see your results, and looking forward to some great results in a new man.
I'm excited.